Okay. Hello, everyone. Good afternoon, and thanks for coming and attending the first of many Lunch and Learns hosted by the net.America Corporation. Um, our goal for these sessions, these quick sessions, is to have a one-on-one opportunity, if you will, to discuss the various topics surrounding registered apprenticeship programs, careers, hurdles, and various items like that. And today we are going to cover our topic on medical billing and coding occupations and training. We have a very special guest, subject matter expert, Mr. Tim Keough. And I'm going to kick it over to Tim, and he's going to present today. And you'll have an opportunity to put your Q&As or your questions into the chat box, and we'll discuss towards the end this afternoon. Okay, thanks. I'm kicking it over to you, Tim.
All right. Well, good afternoon, everybody. Thank you so much for the introduction and for this opportunity to talk to you all about something that is near and dear to my heart, which is two very promising careers in both coding and or medical billing. So that's what I'm going to be talking about for the next half an hour or so. I'm going to walk you through what those opportunities are, how to get there from where you are right now, and also what might be in your future, since those don't need to be the end destination. They could be a springboard for other career opportunities as well. So let's get started. And I also wanted to say, yes, there will be Q&A at the end, but my contact information will be there for you as well. So if you have questions after this presentation, feel free to pick up the phone or send me an email, and I'd be happy to go through any of your questions with you. So just to set the stage, let's talk about, healthcare delivery today. And it's a good starting point for me because, quite frankly, when I think of healthcare, the first thing that comes to my mind are those primary care physicians, the nurses, the people at your bedside, the people that will help diagnose a condition or that will do some surgical intervention for you. Those are all, of course, very important individuals within the healthcare delivery system. And when you go to consume healthcare, when you have to do that, you might find yourself in a number of different settings, right? You might be in an acute care in a bricks and mortar hospital, one of those that might be in your community. Again, bricks and mortar sort of thing where you go there, the attending physician admits you, or you go into the emergency department and you go through a process to hopefully get cured or to find a solution, a surgical intervention that you might need. But aside from acute care, there are other levels of care that you might find yourself in. So, for example, if you need just simple lab work or a radiology test or even some minor surgical procedure, you could find yourself in an outpatient surgical center or an outpatient facility. And if you're at the point in life where you need assistance with activities of daily living, perhaps you're elderly, perhaps you've been in a motor vehicle accident and need rehabilitation, you might find yourself at a level of care in a skilled nursing facility or something like that. But at this point, I wanted to kind of mention the other players that are on the healthcare team that help make healthcare delivery at the highest level it possibly can be. So listed on the slide, I've put just a few, but there are literally hundreds of participants in the total delivery of quality care. But to start off with, you have an administrative team, you have the people in the C-suite, or the corporate officers, the CEO, the chief operating officers, the chief financial officers. They're all very important in terms of looking at the systems, the staffing, the quality metrics that are delivered within a healthcare setting, regulatory compliance, tax burdens, things like that. Those are some of the things that administrators would be involved with. Population health and data and analytics, also very important, especially in light of recent events with COVID, the pandemic that we're hopefully emerging from soon, uh, data analytics have really gone and played a big part in terms of identifying inequities in care, or areas that we could find improvement with, for example, dealing with chronic conditions. So there are people at our healthcare facilities that analyze the information. Quality individuals, these are people that benchmark the outcomes for their particular institution against themselves. So they want to see that they're making improvements in patient outcomes year over year or quarter over quarter. But they're also very interested in looking at facilities that are similar in scope and in size to benchmark against, to make sure that mortality rates, infection rates, things like that, that they are better than those averages. And certainly, last but not least, and this is going to be the thrust of the conversation this afternoon, is the billing and coding, or health information management areas. And what I would say, if we were to use the analogy of a vehicle, looking under the hood, I consider kind of the coding and billing to be kind of the engine of the healthcare delivery process, because without those critical functions, the revenue that a hospital needs, that lifeblood, wouldn't be there to pay the salaries, to purchase the equipment, to improve the building. None of that would be possible without that very important revenue cycle process. Okay. So, and I also, before I move on, I wanted to say a big thanks to organizations like net.America for creating opportunities for training individuals, first to raise the interest in these types of careers, and then to offer training and opportunities to apply themselves to learn these careers. So it's very important for the continual success of the healthcare delivery system. All right. So let's get into some real basics here, which is, what is a medical coder? So first off, the picture that's here I selected because it really does kind of depict what the work environment is for a medical coder. And notice there are no stacks of paper charts on the corner of her desk. There are two screens that are available there, and that is very typical of a workstation for a coder, and probably even for a billing individual also, in that one of those screens would have the electronic health record on it, so you could see the histories and physicals, the discharge summaries, all of the treatments and surgical procedures that may have occurred to a patient. And on the other screen, you would have a coding system or a computer system, basically to enter in all of the specific detail. So at the core of it, a medical coder essentially translates written information from the medical record into numerical, or a classification system, which is a series of numbers and letters known as ICD-10, which is International Classification of Diseases. The 10 is the edition. Back a few years ago, we were on ICD-9. So the CM means clinical modification. And that is a book. And if you look further down on the slide, you'll see that there are over 70,000 potential diagnoses codes that could be at play. And for any particular patient, it's typical that there's more than one diagnosis that happen to be present. There could be as many as 15 to 20 diagnoses at play. We'll call those comorbid conditions. Okay. PCS refers to the procedural components, or all of the different procedures that might be at play, that you might see within a medical record, that would need to be, first of all, the coder would read it. They would look at the physician's documentation and the other clinical providers, and they would discern what procedures were applicable, and they would find the numerical equivalent, and they would put in an ICD-10 PCS code into the system. And just for your information, there's 87,000 and more of those. So there is a lot of choices, a lot of variability, and a lot of training. But at the base of it all, and I put on this slide, why code? Okay, so there's probably more reasons than these four, but first off, patient care. Second, accurate reimbursement. The third would be quality measures. and the fourth would be population health. And before I move off the slide, let me give you some examples of patient care. So in the recent past, we have this, well, it's not even past at this point, but COVID-19. So the ability of a healthcare provider, a doctor's office, to be able to assign a diagnostic code that goes into a database that then gets transmitted to the state and then to the federal authorities allows those healthcare planners on a public policy level, at a very high level, to be able to understand where the pandemic is occurring, if there are any hot spots or areas that need to be focused on. Similar situations have occurred recently that I'm aware of. There was something called EVALI, which is e-cigarette vaping lung injury. And there was a code for that. Coders have kind of a humorous way of saying there's a code for almost anything, that any affliction that you could have medically. So being that there is a code for it, it can be codified, entered into systems, and analyzed by public health and policymakers so that we can make sweeping changes to healthcare policy to address those healthcare crises and improve the health outcomes for the citizens of our state and of our country. Accurate reimbursement, coding is at the heart of our what's known as a DRG system, which means a lot of acronyms here. Sorry about that, but it's the diagnostic related groups. And payers such as Medicare, Medicaid, even private insurance, the Blue Crosses, the Cignas, etc., all use the codes that flow into a diagnostic related group, and that DRG has an associated reimbursement amount that is tied to it. So if you code things properly, you're going to get accurate reimbursement to cover the costs and some margin, some profit, to cover the costs of all of the clinicians, the doctors, the nurses, the building, all of the overhead that's involved. So that's built within the DRG system. And so coding is extremely important for the revenue cycle of all institutions, whether they be a private physician's practice or whether it's an acute care facility or a system of 12 hospitals. Quality measures. Okay, so coding is at the heart of quality measures as well. So things like, what am I talking about? Mortality rates. Let's say an organization it specializes in stroke care. So stroke has an ICD-10 code associated with that. So does sepsis occurrence. So does open heart surgery. And all of the facilities performing those procedures have what's called a mortality rate. So what is the rate of people surviving those surgical interventions? And the way that hospitals are able to understand, are they doing good or do they need improvement, is by doing analytics based on those measures, which again, the heart of that is the code sets that we're talking about. In population health, I think the examples that I mentioned to you before about being able to pick up and track the incident rates of COVID or even Lyme disease or EVALI, the lung injury, is really dependent on the thoroughness of the coding that occurs at each of the organizations throughout our healthcare system. All right, so we've talked a lot about coding. Now let's talk about what do you need to do to get from where you are right now to being an actual medical coder. And so what's involved with the training? Okay, so typically there is a coding certificate program, and there are many of these that are available. Some are in person, some are totally remote or virtual, and some of them are hybrid, depending on which classes and things like that. So you really need to kind of do your homework to look for those training, those certificate programs that are out there. The next thing is the type of coursework that you'll find, regardless of what training facility you work with. On this slide, you're going to see typical coursework includes things like heavy doses of medical terminology, anatomy and physiology, pathophysiology. So you really need to be able to understand, you're not a nurse, you're not a physician, but you do need to be able to understand disease process how diseases progress through the human anatomy. You also need to understand pharmacology, what types of medicines are used for different types of diseases, so that when you're reading them within a chart, those medicines that are prescribed serve as clues to the coder to say, huh, this patient is receiving this medicine. Maybe this diagnosis is present. Let me go look through the doctor's notes to see if I can confirm that. Okay. So pharmacology is important. And of course, you have to go through some specific ICD-10-CM. That's the diagnoses, the PCS portion, those would be the procedures, and also CPT training. So pictured on this slide is just an example of one ICD-10-CM code book. Most coders will have this as a reference tool. Oftentimes, though, they use a computer system known as an encoder. And there are a couple of different brands of encoders where basically all of that information in that book, and that book is probably a good 4 to 5 inches thick, each of them, that's embedded within the encoder system. So coders have their own personal preferences if they use book or if they use their computer. But ultimately, all of the code sets do get entered into the organization's encoder and make their way into the billing system. Okay. There are professional certifications that are involved with careers in coding. Now, it's not required that individuals have a professional certification, but I can tell you from personal experience that we typically only hire people with a HIMA, which is the American Health Information Management Association, or AAPC, which is the American Association of Professional Coding. Each of those organizations has specific credentials. So on this slide, you'll see some examples of those credentials. So for example, CCA, that's the Certified Coding Associate. That's the entry-level coding credential that a HIMA offers. The CCS, which is the Certified Coding Specialist, is really the epitome of the inpatient type of coder. That would be almost the highest level that I look for when we're looking to hire inpatient coders for an acute care facility. But there are others that you see pictured on the slide that you can read at your within your own time. The AAPC also has a number of credentials. So CPC is the Certified Professional Coder. COC would be for outpatient coding, and CIC is their inpatient coder credentials. So basically, what this means is you go through your coursework, you then would have to take an exam, a certification exam, and each of these credentials has their own requirements. So for example, if you wanted to get the HIMA CCS credential, they do look for the coursework being completed, plus approximately 2 years of on-the-job applied coding experience. So it's not just good enough to get the training. Sometimes you need applied experience as well. Okay. So the other interesting thing that I wanted to mention to you is that whether it's a coding career or a billing career that you have, these are what I would call stackable credentials, or you can use that as a springboard into something even greater and higher level of responsibility, and also commensurate with that higher level of salary potential as well. So many people that I know started out as a coder that ended up moving into HIM management, becoming a consultant, moving into technical roles, running a department, health information department, these sorts of things. So there's lots of different opportunities, but coding and billing is really a good foot in the door, and also a solid career unto itself, but it can really be a good place to springboard off of. Okay, speaking about other careers that might come about when you start as a coder or biller, let's talk about the AHIMA Career Map. So AHIMA is, I didn't mention this before, but they are a professional association. I think there's over 100,000 members currently. It's the American Health Information Management Association, of which I am actually the president-elect this year for the national organization. So they have this thing called a career map, and the URL is there for you to take a look at. And I invite you to explore in this particular area. Now, all of those dots and so forth, they represent individual types of jobs. So, and they're broken down into four main areas: coding and revenue cycle, informatics, information governance, etc. So, and when you look at the inside of that circle, those are entry level types of careers. So there's where you would find uh, an abstractor, a coder, a biller, and the further you go out in from the center of that circle, those would be the careers that you could grow into. So just as some examples, I kind of put it all on this slide here. I didn't want to have to switch from the PowerPoint to the live system to the URL. But if you were to click on that inner circle, that dot, that represents medical biller. And here you can see the career pathways that you can pursue. Data analyst is one, health information technician is another, implementation support analyst could be yet another. And when you click on those individual buttons, it'll give you a description of that career, what the responsibilities are, what the salaries, the potentials happen to be. And also, I think there's a link to different career sites that you can actually see active jobs that are available for professionals in that particular area. So it's a very powerful tool, and I think you'll enjoy exploring that just a little bit. All right. So at this point, I'm going to switch over a little bit and talk about what is a medical biller. Again, very important to the revenue cycle of any organization, be it an acute care facility or a physician's practice. But a medical biller, essentially, it starts with patient admission, with gathering up the type of insurance that a patient has, but they're going to basically process claims. They're going to make sure that charges are entered properly for a particular patient. They're going to look at the insurance types that a patient has and what the requirements are to submit a bill to that particular insurance company. There are so many different insurance companies, and each of them have their own requirements for what is required. But it's very, very complicated, and the training programs that are available for medical billers go through all of that and equip you pretty well to be ready for jobs in that particular field. So the skills that are required for billing include things like patient registration. So you need to be have good interpersonal and communication skills to be able to speak with patients through that registration process. Insurance verification, how to do charge entry, how to post charges to an individual's account. You'll also learn how to receive payments and post them to the patient's account. All very intricate steps, but very important steps. And I've mentioned throughout this presentation that there are a number of different settings that you could find yourself in, not only acute care, but you could find yourself at a system level. So for example, Robert Wood Johnson Barnabas, they have a system billing office in Oceanport that serves all of their facilities. And I know that Hackensack Meridian has centralized billing as well. So, but there, for physician practices, for outpatient clinics, you'll find billing offices in all of these particular settings. So, okay. So to become a medical biller, just as with coding, there are some similarities in that you do still need to have medical terminology. You need to have a basic understanding of anatomy and physiology, and you need to go into great detail regarding the billing and claims processing. But so you might be thinking to yourself, well, I heard that you need medical terminology and anatomy and physiology for coding too. That is correct. I would say for coding, you need much more in-depth understanding of physiology, of medical terminology, of reading clinical notes. Whereas medical billing, I'm going to call that kind of a more entry-level understanding of anatomy and physiology, and that would be sufficient. So there is a professional certification for billing, and that is through the AAPC, that's the American Association of Professional Coders. It's the CPB certification, which stands for Certified Professional Biller. Okay, so if that's something you're interested in, I would say definitely go to their website and take a look and see and learn more about it. Okay, so let's talk a little bit more about some of the impacts of coding and even of billing on issues like price transparency, quality measures, revenue cycle, and also compliance. Okay, all very important things in the world of healthcare. So I've pulled out some examples here to just kind of demonstrate some of these points, but I work for the New Jersey Hospital Association, and we have a division. It's called CHART, and it's an acronym, and you can see it here on your screen. It's the Center for Health Analytics, Research, and Transformation. Now, CHART routinely looks at current issues that are or problems that are confronting New Jersey citizens or public policy relative to healthcare, and they research it. So, for example, in this presentation, and we'll make sure that you have a copy of this, and there are hyperlinks within this presentation. So, for example, you'll see New Jersey's most vulnerable communities. You'll also see a report on healthcare efficiency, and also, finally, a report on chronic conditions. There are actually other reports on their website, but the point that I want to make is each of those bits of research or white papers that are available to citizens of our state, but also to elected policymakers, all of that is based on the coded information that's entered into our systems at a site level that gets transmitted to the state Department of Health and then ultimately goes up to the federal level that allows for this type of data analytics. Okay, so coders are at the heart of that. Okay. The next thing that I want to talk about is, and I mentioned before, you may have heard me say price transparency. Okay, so the analogy that I use for this is, I think everybody has purchased something on Amazon. Okay, as insignificant as it might be, it could be a toothbrush, but when you purchase something on Amazon, you look to see what's the cost, and you can see different providers, how much they're charging for that. You can look at the quality ratings, how many stars does it have, and you can actually read reviews. But think about that. Do you think of healthcare in the same way as you think about the purchase of any sundry item that you might purchase, a vacuum cleaner? Typically, the answer is no, that you don't do that. So there is an initiative within healthcare, not only within our hospital association at the state, but also on a federal level, to bring about price transparency to allow consumers and purchasers of healthcare, like the Blue Crosses, the Aetnas, the Medicares of the world, to be able to see how much they have to pay for certain conditions or certain procedures. So NJHA does have this system, and the URL is listed on the top of this slide. It's called Hospital Price Compare. And I'll flip to the next page just to kind of show you an example of what this can do. So, for example, you can go ahead and, in this case, on the left-hand side of the screen, you'll see that I selected hospitals in Monmouth County. Next, I chose Hackensack Meridian, specifically Jersey Shore. And the diagnoses, or the DRG that I selected, was headaches without an MCC, which means without a major complication or comorbid condition. So here on this screen, you'll see that it returns results almost instantly. It actually shows you for the selected hospital what the charges are, or what the cost is. Well, mostly charges for that particular hospital, but then it compares it to hospitals in the county. It also compares it to hospitals that are similar in size of bed size. And it also, in this last column here, it shows a comparison from that hospital to all hospitals within the state. So, and that's basically, again, transparency. I bring that up because at the heart of that, not only from the billing perspective, the charges that go into a claim, but also the code sets that make up the DRGs. Without both the charges being entered accurately and the codes, this type of analytics would not be possible. Okay, next let's talk about hospital quality. Okay, very important. Again, using that analogy of going to Amazon, whatever the product is that you're looking for, you want to look and see how many stars it has. You want to read the reviews. You want to see all the information you can find out about that particular product. It should be the same way for your healthcare, right? So the New Jersey Hospital Association put together this page. It's called NJ Care. So you can actually go onto this particular site, and pictured here are 5 or so different quality rating agencies. So you've got the Joint Commission, you've got the Leapfrog Group. All of this is very important, and it's available to you as a consumer. So I would definitely encourage you to learn more about these sites and go ahead and peruse it a little bit at your leisure. Okay. So now let's talk about coding and data quality. Okay. Just think about this for a second. Pictured on this slide, I've got this billboard that says congratulations. And, I grabbed a photograph. This is from a hospital in Tampa, Florida. But you see, they have their ratings. Best U.S. News and World Report. So they're the best for different types of procedures. And within New Jersey, as you're driving our freeways and our Garden State Parkway, you're going to see different billboards saying, number one in obstetrical care, or number one in heart surgery, or best in stroke treatment. All of that data analytics, again, comes from the coded data that an ICD-10 CPT coder enters into our system. So very important. Now, by now you should realize that coding and billing are extremely important to the revenue cycle. But I wanted to make it really clear. I've talked about how it's important for quality metrics and for revenue lifeblood. But I want to point out very clearly that when you have an error with coding, it can cause a lot of problems for the institution. So from a compliance perspective, an error, take for example, if you're talking about Medicare or Medicaid, these are government entities that pay or reimburse for healthcare. Oftentimes, an error is not called an error by those institutions. They will actually call it fraud and abuse, even though it may just be a mistake. Fraud and abuse is something that's very problematic, in that you want to make sure that the codes that you're putting into a system are thoroughly documented and supported by the physicians and other clinicians that are writing into that electronic health record. Okay, and for that reason, the other picture that you see here, this XYZ hospital, this is just a sample of what I'm going to call an internal audit. So yes, coders code every day. They put information onto a claim. The charges flow into that claim. But it's always recommended that organizations, whether you're a hospital or a physician practice or anything in between, that you do routine audits of your coders' work to make sure that it is accurate, that you're getting reimbursed appropriately, and that you're not coding anything that is not substantiated within that medical record. So I've often said that coding is a high stakes game. It's extremely important because so much depends on it. Okay. So with that, what path will your career take? And, there's a quote that I'd like to share with all of you. And it goes like this. It says, "I'm a great believer in luck, and I find that the harder I work, the more of it I have." That was a quote by Thomas Jefferson. And of course, there is no substitution for hard work. That's really what my point is here. These are very rewarding careers, coding and billing. It could be the end path for you, and you could certainly make a great career of it, or it could be kind of an in-between staging point where you master that, do it for a while, and then you can grow your career beyond that. But things that you should do beyond getting the training and doing apprenticeships to get hands-on training with these two careers is, make sure that you have a solid education and that you have that experience. And always present a positive image of yourself, because there's a lot of people that are out there competing for these same jobs. So be proactive in building your career. And there's certain things that you can do to be proactive, and they're listed on this slide. So for example, network within that community, communicate. So those organizations that I just mentioned within this presentation, which include HIMA and also AAPC, each of those has state chapters within various counties. So there's one not far from you. I would suggest that if you're interested in this as a career, join those organizations, become volunteers, and get to know those members, because I bet you those will be the people that end up offering you your first job. So that's the volunteer part is critically important also. So now at this point, I wanted to open up the floor for any questions. I'll check the chats for just a little bit. My contact information is here. You'll find my telephone number and also my email address. So I invite you to reach out to me with any additional questions that you might have. It's been my pleasure speaking with you all today. And for those that are maybe reviewing this at a later date, it's been my pleasure. So now let's take a look at the chat feature. Let's see. And Jasmine is, or David, are there any questions that you see? Okay, here we go. Let's see.
Yep, I do see some here, Tim. Is
Fantastic.
it on the
So
okay.
yeah, let me just scroll here so I can kind of see a little bit better. All right. So the first question, how long does it take to get certified, and what age do you have to be? Are there a lot of part-time positions? So, how long? Some of that depends on, what you're, if you're working full-time and taking these courses, if you're a full-time student or if you're a part-time student. But I think these courses, if you go to places like Rowan Burlington County College, if you go to Camden County College, Passaic Community College, many of our community colleges have coding and billing certification courses, and I think they're somewhere between 24 to 30 credits. So I think you could probably do a certification if you really put your nose down and took 2 or 3 courses at a time. Probably within about 12 to 18 months, you'd be able to get that certification. And in terms of, let's see, at what age do you have to be? Well, typically you're going to need a high school diploma to be able to qualify to get into those certification programs. So I would say, 18 and up probably, but, it really depends on your getting the high school diploma. And are there a lot of part-time positions? So at the Hospital Association, I run a division that it's a HIS consulting division, and there's many of them that are out there, a lot of competition that I have. We hire full-time coders. We also hire part-time and per diem positions. So yes, there are lots of part-time positions also. Okay, so thank you for that question. Okay, let me see if there are others. Okay. What's the potential salary range for medical coding and billing? Okay, another great question. And I would say that, and I have a lot of experience with this because we hire coders, not so much billers. We don't do billing at the Hospital Association. We do coding, but I would imagine billing is going to be somewhat about the same range. It really depends on how much experience you have. So first off, we do not hire anybody without a credential. So we're looking for that HIMA or AAPC credential. And we're also looking for a certain number of years of experience, typically 2 years of applied experience. So if you have lots of experience, let's say if you're, and I guess it's also important that I point out, there's different types of coders. You have outpatient coders and inpatient coders. Outpatient coders is considered to be more the entry level type of coding. Even professional fee or physician coding is considered more entry level. So those salaries might be in the $50,000 to $65,000 range, whereas inpatient coders we typically see might be between $60,000 on upwards to $90,000 per year. Oftentimes, people that are really good at this, they might have a day job where they're a coder for an institution or an organization, but then they might be a per diem or a consultant coder, basically working for themselves for various organizations. And, those individuals have great potential to earn a very handsome salary. Okay. Aside from salary, another question is, would there be benefits to working in a hospital versus a private practice? Well, The answer is partly explained from my prior answer, which is the private practice that would be pro fee types of coding. And just the way I've always looked at it is that's more the entry level. It's not as complex as acute care coding. So the salaries typically tend to be less working in a physician practice or a group of physicians. Um, and I'm not really quite sure of the benefits, but if you're working for an acute care facility, typically the benefits, or even for the hospital association, the benefits are typical that you would find for employment as a full-time employee of these organizations. So, you know, just to kind of run through some of the typical benefits, I think it usually starts with 2 weeks vacation, all of the paid holidays, which might be about 10. A lot of organizations have PTO or paid time off that all these hours for sick, holiday, and vacation goes into one bucket. So, but there are good benefits to be had with the career of coding or billing. Great, we're getting good questions here. Do most people start off in private practice before moving on to a bigger setting? The answer is kind of yes and no. Um, some of it some of it really depends upon that networking that I talked about before, and also it some of it is dependent upon the experience that you've been able to get. So one thing that you need to get is the training from a coding or billing certificate program. But then you need the hands-on training, such as can be garnered through an apprenticeship program or other types of programs. So if you could find yourself working in an acute care facility, getting hired into one of those entry level, perhaps an outpatient coding position, I'll call that the foot in the door. Or even the next level would be emergency department coding. Um, I think that is a great way to get your foot in the door to get to those higher level, higher complexity coding jobs, such as you would find in an acute care facility. But certainly working at a private practice is rewarding as well. And I think you would probably find yourself more in a generalist position there. You might be doing some things in addition to coding. You might actually be doing some of the charging and billing in an acute, rather at a pro fee or a physician's practice. Whereas in an acute care facility, if you're a coder, you're a coder. You're not really doing billing and vice versa. Here's a good question, which is what is the typical, what's the a day in the life of a coder? So, um, I've been a director of health information management before, so I've had coders report to me at an acute care facility, but I also manage the New Jersey Hospital Association's division, and we've got lots of coders that work. So a typical day in the life is um, you are a fact finder. You need to be a very detail oriented individual. So you'd wake up, oftentimes you'd be working remote. Um, the majority of our coders, even those that work for acute care facilities, are working in their home offices with two monitors. They have an encoder system, which they put their data into. They may have code books on their desk. They might have coding clinics, which are reference materials on their desk. They will typically, an inpatient coder will code approximately 20 to 25 inpatient charts per day. If you were an outpatient coder, you might be coding 200 to 250 per day. If you are an emergency department coder, you might be looking at completing about 90 to 115, 120 charts per day. So I give you this number because aside from going through each and every one of those patient records and pulling out the pertinent diagnostic and procedural information, which ultimately will generate the bill and the reimbursement that you're going to receive, there is a certain amount of pressure to get it done accurately and to meet those productivity or throughput standards. Those are benchmarks that are pretty accepted both statewide and on a national basis. So in order to be a viable coder, you really need to be able to meet those productivity standards. So there's a fair amount of pressure to get the work through. Something in the business, it's called DINFIB. It's an acronym. It stands for Discharged Not Final Billed. hospital chief financial officers do not like discharge not final bill. They don't like to have accounts a week after discharge being unbilled. Typically, organizations like to have the charges in on those claims and the code submitted typically within 3 days after a patient's discharge. So there's a bit of pressure. There's a bit of oversight in that your work will be quality assured, as I mentioned, because it really doesn't only impact the reimbursement, but it could have compliance implications. It could have quality measure implications. It could have public health implications. So your work will be reviewed. So you need to be the type of person that can take constructive criticism and feedback. But typically it's done in a very growth-oriented manner. Most organizations look at it as a learning process, not a gotcha moment. Okay. Now I'm just going to scan to see if there are any other questions.
I do believe that was the last one.
I think we did. Yeah, I
Mhm.
think we covered them most. So again, before I pass it back to you, I just
Yeah.
wanted to say thank you for this opportunity. I've really enjoyed being able to speak about these two professions, which I tell you really have tremendous potential, and we have a need for dedicated people in both billing and coding. So I would say, you'd be in good stead if you followed a pathway to these careers, and I would look forward to working with you as either an AHIMA or an AAPC member, and being a productive coder or a biller. So thank you very much.
Thank you very much, Tim. Very, very useful information. And for our listeners on the line and future listeners through our site, just in-demand occupations. It's like ding, ding, ding when I hear that. So many people want to know, where can I go and get on a path to a good career. And so yeah, definitely hope some of you take the opportunity to follow up on some of the info presented today. Thank you again, Tim, and thank you to everybody. We will see you next week. If you want to join us for our next Tuesday Lunch and Learn, you can follow us on Facebook, on our Twitter, and on our website. And we look forward to seeing you soon.
Okay, thank you. Bye-bye.
Bye-bye.